I want to talk to you guys about liver function tests because I know that a lot of patients come to see you with these problems, and hopefully I can give you an algorithm and a way to approach these patients because it can be confusing for a lot of people. We're going to go through a whole variety of liver abnormalities, and hopefully we can piece it in a comprehensive yet concise manner to make it more approachable for you to help out with your patients. So as an outline, we'll kind of go through a general introduction of what liver function tests are. We'll go through the 4 or 5 main categories of liver function abnormalities. And this is the way I want you to learn about it in your head, because if you classify it according to these categories, I think it's going to make it a lot easier for you to understand how to approach your patients, and more importantly, how to take care of those patients as well. And we'll talk about some of the non-invasive and liver biopsy testings and whether to do them, when to do them, and what options you have to see if there really is inflammation within the liver. So just as an introduction, a lot of people have liver abnormalities. Roughly 12% of the US population will have some elevation of their liver tests, whether it's the ALT, AST, GGT, alkaline phosphatase, or bilirubin. But more importantly, a good number of these patients will actually resolve to normal whenever you check the test a second time a couple of months later. And so keep in mind, about a third of the patients who you see in your clinic who have abnormalities in their liver tests, they will go back to normal within the next checkup in a few weeks to a few months. So not everyone who has a first-time elevation of their liver tests needs a full workup to see exactly what's going on. Roughly 35% of the patients who have an elevation of their ALT will go down to normal, 21% for ALT, 12% for GGT, 16% for alkaline phosphatase, and roughly 37% of patients who have elevation of their bilirubin will go down to normal as well. Now, the way I want you to categorize the patterns for liver function tests is basically this chart right here. So most people come in to see you in the clinic for first-time elevation typically do not have any symptoms. It will usually be an incidental finding that you find in somebody who you just happen to check routine blood tests on. The ALT will be slightly high, but it'll be typically less than 3 times the upper limit of normal. Then you'll have an acute hepatitis picture, and most of these patients who have acute hepatitis will have jaundice, fatigue, and arthralgias. And typically the liver numbers will be very, very high and will be extremely elevated. And these are the patients who we want to work up for further liver abnormalities. In a subset of patients, you'll have what's called chronic hepatitis, in which they'll have elevations of their liver tests for roughly 3 to 6 months. They won't be so high. They'll be roughly 1 to 1.5, the upper limit of normal, but they'll stay elevated despite the fact that you recheck it a couple of months later. But most of these patients will have very minimal symptoms, if any. Then you'll have patients who have more of a cholestatic pattern. These are patients who have more of an increase of their alkaline phosphatase more than their ALT or AST. And once again, most of these patients will have minimal symptoms. And keep in mind, you can have an overlap between any of these combinations that you have here. Any of these can overlap with one another. But this is the typical pattern I want you to keep in mind whenever we approach patients who have abnormal liver tests.
Guys, thank you very much for watching. Make sure that you like this video if you like it. If you don't like it, then do unlike. Like this video, subscribe to the channel, and please share this channel with others as well.